I get it, folks. Choosing a Medicare plan can be very confusing and challenging. Which one is the best? Medicare Advantage or Medicare Supplement plan? And what if you have health conditions that need specialized care? How do you know which Medicare plan would work best? These days, I'm having a lot of conversations with people who are specifically asking me how Medicare Advantage plans cover cancer. Hi, I'm Rick Teska, owner of Strive Medicare, where making Medicare simple is what we do every day. We make these videos to help people make the best decisions when it comes to their Medicare. Remember to like and subscribe so you can be the first to be notified when we release important new Medicare information in a video. For those of you new to Medicare, I want to quickly recap what Original Medicare is and what it covers. Medicare is provided by the government and includes Parts A and B. This is also called Original Medicare. Parts A and B pay a large portion of your inpatient and outpatient care. For most of you, there is no premium for Part A. And Part B usually costs $170.10 per month, and that's usually taken out of your Social Security check. The alternative to Original Medicare coverage is to enroll in a Medicare Advantage plan, also called Part C of Medicare. When you enroll in a Medicare Advantage plan, you go off of Original Medicare, and your chosen Advantage plan will manage your care or your coverage. Each Medicare Advantage plan has its own summary of benefits, which will tell you what your out-of-pocket costs like deductibles, maximum, and co-payments will be for various healthcare services. For example, you may pay a $20 copayment to see a primary care doctor and a $50 copayment for a specialist. These are common copayments in most Medicare Advantage plans. However, hospital stays, nursing care, surgeries, physical therapy, and cancer treatments have even higher copayments and out-of-pocket costs and amounts. At first glance, $210 here and $50 there doesn't sound so bad. But you need to look further into the plan's summary of benefits, especially the out-of-pocket maximums, so you're prepared and not surprised by some huge hospital bills later on. Some plans have an out-of-pocket maximum of upwards of $6,700. In addition to the out-of-pocket costs of these plans, it's important to also know the coverage rules that generally apply to all Advantage plans, such as prior authorization for certain procedures is common, especially in Advantage HMO plans. You must use the providers within the network, and you must obtain a referral from a primary care physician before seeing a specialist on many of the HMO plans. You are responsible for cost-sharing expenses or co-payments for treatment. Some cancer services under Medicare Advantage plans require you to pay of upwards of 20% of the cost for that treatment. You will pay this until you reach the plan's out-of-pocket maximum, and that maximum can be as high as $6,700 per calendar year within the network and even higher out of the network. Advantage plans may also require step therapy for Part B medications. This means that you will have to try a less expensive drug before a more expensive one is covered, even if the cheaper drug is less effective. For people with a history of cancer or currently being treated for cancer, out-of-pocket costs can become a huge financial burden to a person, and access to critical care may be limited or denied altogether when you need it most. There are some specific concerns about the Medicare Advantage program that all beneficiaries like yourself should be aware of when it comes to their coverage expectations. The Office of Inspector General recently found that Medicare Advantage plans deny care at a relatively higher rate. 4 in 5 Medicare Advantage enrollees are in plans that require prior authorization for critical services, including Part B drugs, hospital and skilled nursing facility stays, lab tests, home health, and medical equipment. Step therapy requirements can mean that patients are denied access to new and better medications until they have tried a less expensive drug. For cancer patients, this can mean delays in using the best treatments to treat their cancer side effects and treatments. Making decisions regarding which Medicare plan is right for you can be complicated and confusing. But no need to worry, we're here to help. Cancer patients often find that Original Medicare paired with a Medicare supplement is their best option for covering those treatment costs. This chart provides a clear look at your potential out-of-pocket expenses depending on the Medicare plan you choose. Figures are based on a hospital bill of $80,000 for some of the most common cancer treatments prescribed today. It compares coverage whether a person has original Medicare with a Medicare Supplement Plan G, a Medicare Advantage plan, and then also those on original Medicare only with no supplemental insurance. As you can see, having original Medicare paired with a Medicare Supplement Plan G offers the least amount of out-of-pocket cost to you in this situation. If after hearing this you are thinking that it might be time to look at how your current coverage stacks up, the upcoming Medicare annual enrollment period, which runs from October 15th to December 7th, is the best time to do so. My team would be happy to help. Whether you're new to Medicare or perhaps already on Medicare and questioning whether or not you are in the best plan, call or click on the link in the description below to book your free consultation. And don't forget to subscribe to our channel for the latest Medicare news. Thanks for watching.